Hi, this is Jared Moss. Today we're going to be talking about a Greenlight laser vaporization of the prostate. You're probably wondering, what is a Greenlight laser vaporization of the prostate, or what I commonly refer to as just a green light to keep it simple. The technical term is a transurethral vaporization of the prostate. In simple terms, it basically means it's a surgery to treat men with BPH, or an enlarged prostate, to help them urinate better. It's an outpatient procedure where we're able to go in transurethral, meaning we're able to go in and do the entire surgery through the urethra, no incisions on the abdomen or anywhere else. And we basically shine a special light into the prostate tissue area, and we vaporize the prostate to help open it up so that the flow of urine down through the prostate and into the urethra and out of the body is going to be a much smoother transition. Another question is this different, or why is it different? What's special about a Greenlight? The traditional procedure is called a TURP, or patients often refer to it as a TURP or a Roto-Rooter. But that was a transurethral resection of the prostate, not a vaporization of the prostate. And why that technical detail is important, it comes down basically to blood loss and whether or not you need to be observed in the hospital overnight. The major advantage to having a Greenlight performed is it's exceedingly rare to have to stay in the hospital overnight. With the traditional TURP, you would go in, very similar procedure, and the prostate tissue is going to be resected. But as you do that, a lot of times this creates quite a bit of bleeding. A large catheter is then placed, and then the patient is observed in the hospital overnight. They typically will run saline through the catheter, and if the urine is clear, then hopefully the patient will go home the following day, typically with the catheter in place. The benefit to having the Greenlight, which is a little bit newer, it's been around for probably 10 years, is that the special laser wavelength actually vaporizes the prostate tissue, but it also vaporizes the red blood cells, which almost makes it a bloodless type procedure. I typically will tell my guys there's probably a 1 to 2% chance that after the procedure I say, man, it was just a little bit bloodier than we expected. We're going to need to observe you in the hospital overnight to be on the safe side. So that's pretty rare. So it's nice for patients to be able to come in, they get their procedure performed, they go home with the catheter, and then typically 24 to 48 hours later, the catheter comes out, and hopefully they're able to urinate quite a bit better with regards to improvement in their urinary stream. You may be thinking to yourself, well, this sounds wonderful, but what are the risks? The one thing I love to tell my patients is the only routine surgery is someone else's, and that is also true for this. The risk of the surgery can be the risk of anesthesia, heart attack, and stroke. That could be common with any type of surgery. There's risk of blood loss or bleeding. There's risk of a urinary tract infection. There's risk of scar tissue that can form afterwards. There's risk of needing to have further procedures and more tissue removed. The one nice thing about this is it's pretty rare compared to some of the other BPH procedures that have been done in the past, such as a tuna or a microwave or things like that, is a lot of times patients did good for maybe 2 or 3 years, and then their symptoms came right back, and they were either on medicines or having to have more surgery. The nice thing about the Greenlight is it's a very, very wide resection of the prostate. And it's pretty rare that men are going to have to go back in and have to have another surgery to re-resect tissue to get them back open so that they're urinating well without medicines. We said before, again, this is an outpatient surgery. It's almost always covered by insurance. I can't think of any situation that I've ever encountered where it hasn't been covered by insurance. Again, the catheter is typically worn for 24 to 48 hours, and then we'll take the catheter out. Another important question is, when should I see improvement in my urinary symptoms? Most men that are going to be undergoing a Greenlight have typically been on medicines such as Flomax or finasteride. These are the types of medicines that relax the prostate or shrink the prostate. These are medicines that typically these men will have to be on for the rest of their life, and that's one of the reasons why men may want to choose to pursue surgical therapy, is to hopefully have a great urinary stream, be able to get off of prostate medicines or even overactive bladder medicines. But it's super important to remember that once that catheter comes out, I typically tell my guys, look, I don't expect you to be real happy with your urination for probably at least 6 weeks. When you go in initially and look at somebody before they've had a Greenlight performed, it's very obstructed. It's hard to see through the prostate into the bladder. Then all of a sudden, overnight, it goes from being obstructed to being wide open. that bladder's used to having to bear down to get the urine through the prostate and out of the body. And so all of a sudden that tissue has been removed, the dam's been removed, and the guys will tell me, man, doc, I got a great stream, but I am having a lot of trouble making it to the bathroom in time. Maybe I'm having some leakage of urine before I get there. I'm having frequency. I'm having urgency. I'm having some burning with urination. Occasionally, I'm still having some blood in my urine. These are very, very, very normal symptoms, and they'll come and go, kind of over that 6-week period. So it's very important to have your expectations to realize these things are normal. They're going to get better, and hopefully by 6 weeks, I'm urinating great. I have a good stream. I'm able to make it to the bathroom in time. And, my goal is to basically get, patients off of all prostate and bladder medicines. That's not always possible, but it's possible in a very, very large portion of men, and certainly that's the goal of the procedure. That's what we're trying to do. So this kind of winds up the Greenlight laser video. I've included some slides here in the end. A slide of a physician that's actually performing the Greenlight. You can see the laser, and it's green in the operating room with the lights down. I've also included some pictures of prostate anatomy showing an enlarged prostate with BPH, and then as they go in to open it up and use the laser to open that area up and kind of core out the apple, you can see that the area opens up quite a bit. And thus kind of giving the common procedure name, the Roto-Rooter. That's essentially where it comes from, as we're going in to basically unclog the pipes. I hope that this video has been helpful and informative. If you have any questions, please let us know. Our website's regionalurology.com, and our telephone number is 318-683-0411. Thank you very much.